Hi everyone. Today we will look at into the clinical implications or medical issues that usually presented with those with eating disorder.
Hi guys, now let's meet our patient Mona. She is a 15-year-old present to the physical clinic and she had some kind of injury. She plays basketball for the national team. She complained that she does not present with any period, amenorrhea, for the past 6 months. And the mother concerned about her recent weight loss, where Mona associate with excessive playing and training as a basketball player.
This slide to show the risk factors that put individual at risk of developing anorexia nervosa or bulimia nervosa. What you can see, both actually share the same kind of psychiatric disorder like anxiety and depressive symptom. Anorexia nervosa is also commonly present among individual athletes like gymnasts. They also have some kind of childhood history that you should consider when look at into their client history assessment. This is an important slide to summarize the common physical presentation that commonly present in those with anorexia nervosa, bulimia nervosa, and binge eating disorder. So those with anorexia nervosa, you can see they commonly present with very low BMI. Yeah? Bulimia nervosa because they had recurrent purging. Yeah? Despite they binge, they usually presented with normal weight or slightly underweight. Whereas those with binge eating disorder, because the characteristic of binging episode that they are always had an obesity as one of the main issues. Medical presentation or clinical implication of the patient as shown in the slide. So we know that those anorexia nervosa, they are always present with low BMI leading to cachexic characteristic. With cachexic characteristic, they will have low blood pressure, low heart rate or medically known as bradycardia. They also had lanugo. Yeah? And what is lanugo generally? And what caused this hair to grow? If you remember lanugo, remember a baby who just born, you can see at their back, they have some kind of hair. So lanugo is generally developed to protect us uh, from cold. The body grow lanugo to protect or to maintain our body temperature as fat store are depleted. This is a common symptom among those with deep starvation. Yeah? The lanugo hair is characterized by soft, downy, fine white and light hair that grows mainly on the arm, chest, back and face of individual with eating disorders. They also may present with brittle hair due to some of the vitamin deficiency. Yeah? Mila, can you find me what are the vitamin or nutrient important to maintain your hair healthiness? Yeah? And they also had dry skin, and this will relate to their food history later that I will explain. For those with bulimia nervosa, the clinical sign and symptom are more difficult to detect. Yeah? Because patients are usually having normal weight and they present with secretive behavior. But one of the things that you should be able to detect if they involve with quite frequent number of compensatory behavior via or vomiting, yeah, you can see the Russell sign. Yeah, it is a scarring of the dorsum of the hand that used to stimulate the gag reflex. Maksudnya dia jolok tu. So when they push, yeah, so you can see some kind of sign in their hand. I have seen this, and this is what we call as Russell sign. And due to the frequent vomiting, it will also erode their dental, and they may also present with esophagitis disorders. Uh, this is also an interesting slide to figurize and summarize, yeah, the medical complication for those with bulimia and anorexia nervosa, which I believe if you look at among those anorexia nervosa, they had more pronounced medical complication as opposed to bulimic. I will post a very interesting video shortly, yeah, a medical Chicago drama to show how those with anorexia nervosa who doesn't want to be treated. Although ED, which is anorexic and bulimia nervosa, are classified as psychiatric illness, they are associated with significant medical complication that will lead to morbidity and mortality. Yeah? For example, cardiovascular complication here may include the clinical presentation that we mentioned earlier, like bradycardia, hypotension, yeah, very low blood pressure, that finally lead to cardiac arrhythmias. But the good news is that, however, the cardiac function is largely reversible with appropriate nutritional rehabilitation. Yeah? So the interesting word when you learn eating disorder, especially among those with anorexia nervosa, is the word nutritional rehabilitation, as well as weight restoration. I would also like to highlight here that when you care with people with anorexia nervosa, you have to be careful with electrolyte imbalance and deep starvation that they have been experienced for some time. Yeah, if you look at into the Chicago medical drama that I will post it shortly, they have been with anorexia for 15 years. So when you wanted to start feeding them, you have to be very careful, yeah, because they are high risk of developing refeeding syndrome that will lead to shock and mortality. Okay, so this slide to show the spectrum of management. Yeah? You have been discussing that majority of the role is played by a dietitian, but we have to remember that the treatment of eating disorder requires a multidisciplinary approach because number one, ED are complex psychiatric illness that require physiological assessment and ongoing treatment. So here, the psychiatrist will work very closely with clinical psychologists. And then the long-term goal of psychosocial intervention in anorexia nervosa are number one, to help patient understand, then cooperate with the nutritional and physical rehabilitation. Yeah? So we have to work hand in hand with psychologists, clinical psychologists, psychiatrists, medical intervenes, and we that play an important role to provide nutrition rehabilitation in managing eating disorder. Thank you and see you again in the next lecture for nutrition care process.